Okay, so I did my literature review on autism spectrum disorder, early identification before the age of 3. Autism spectrum disorder, also known as ASD, is a general term for a group of complex disorders of brain development. There are varying degrees for an autism diagnosis, ranging from mild to severe. Children all on some level experience difficulties in social interaction, verbal and nonverbal communication, and repetitive behaviors. And the condition affects 1 in 68 US children. The range from mild to severe, if you were to categorize them, Asperger's syndrome would be on the more mild side, generally higher functioning, socially awkward, but often having an all-absorbing interest in specific topics. That's why there's a stereotype that children with autism have excel in certain subjects like math and science. It's children with Asperger's syndrome. Pervasive developmental disorders, not otherwise specified, is it's more mild than autism, but it's not as mild as Asperger's, so that's why it's just like a range, like right in the middle. And then there is autistic disorder. People with this condition appear to be living in their own world, showing little interest in others with a lack of social awareness. That's the most severe. Things people with autism might also be diagnosed with or struggle with are sleeping disorders, ADHD, seizures, dental issues, gastrointestinal symptoms due to toxins that their own body produces. Often they harm themselves or struggle with depression and anxiety. Signs of an infant with autism are milestones displayed in typical developing infants just aren't being met. So that's a lack of smiling, rare imitation of social cues, delays in babbling or cooing, unresponsive to their name, poor eye contact, infrequently seeking attention, lack of gestures, repetitive behaviors, delayed motor development. But the reason it is so hard to diagnose is because children begin to show signs or start to reach these milestones. Typically developing is really like a 4 to 5 month range. Children can typically develop these different things. So maybe they're unresponsive to their name, but you can start responding to your name 2 months to 10 months. I mean, these ranges are quite large. Why is it important to diagnose before the age of 3 if it can't be cured? Because it can be treated, and early intervention is very critical to success in these cases. So to really customize programs and curriculum and school settings for these children to meet their individual needs is really important, and screening and diagnosis is the only way to find out what these children need specifically. Children born to siblings with autism are at high risk for the disorder, and that's something that these studies will take a look at, that range of those children born to siblings with autism, and the look for that was obviously a predisposing factor, the fact that runs in their family, but also knowing that this is a high risk group of children. They'll do studies, run studies on them, and it'll make their assessments a little bit more accurate. Something that's important to know is that pediatricians screen for autism spectrum disorder at every doctor's visit during infancy. When they walk into the room, the first thing they look at is, did the child respond to me walking into the room. If they didn't acknowledge the doctor's presence in the room, that could definitely be a sign that something's not developing properly. It can be done as early as 12 months, but it's normally not confirmed until around 3 years. So the MCHAT is an assessment that it's a casual assessment that can be done. It's like a parent screening, so parents will answer questions about their child. The earliest one I found assessment-wise is for toddlers, but the 60 minutes right at 4:50 talks about questions 6, 9, 10, and 14 of that paper, of that assessment. So I printed out the assessment for everyone and was going to hand that out and have people kind of answer yes or no. Did the typically developing child display it? Even though the answers are given in the 60 minutes, I just really wanted to kind of give the idea of an assessment tool to the class. So 4 minutes and 50 seconds. We'll see what happens.
I'm aiming for 12. She's tracking 200 babies from birth, like Gabe, a normal 12-month-old, being tested for his reactions to a new toy. And he's very interested in it, and he communicates that to her with that great look, big eyebrows raising, smile, and then he asks for it without language. I want that. And this is typical of a healthy one-year-old child. Exactly. But when this boy Jacob is shown the same toy, he stares at it in silence, never reaching for it, never looking up at the examiner. There's no communication at all with the
MCHAT kind of asks questions like, does your child respond when you're trying to engage with them? Yes or no? Does your child often acknowledge your presence? Yes or no? Do they respond to their name? Things like that. And in the 60 minutes, the next 3 minutes of it, we'll talk about a couple of those things. So I figured giving the example of the assessment tool and giving the example of a video that displays both a typically developing child and a child with the disorder was kind of a good visual and kind of a cool activity for the class to get that hands-on visual. So that pretty much concludes everything. I really enjoyed doing this. I'm very interested in autism, and I kind of have some hands-on experience with the children of this background and this nature, and I think it's awesome to get to know a lot more about it. So yeah, that pretty much is it. Thanks for listening.